Is your period late or missing? Or is your menstrual cycle length normal for you? In this video, I will discuss what is happening hormonally in your body when your period is late or missing. By the end of this video, you will understand the 14 causes of late or missing periods. This will help you identify the possible reasons why your period is missing and send you in the right direction for a correct diagnosis. And more importantly, get you the right treatment to balance your hormones and bring back regular menstrual cycles and predictable periods. In my 10 years of being a naturopath and helping women with hormonal imbalances, I can't stress enough the importance of a correct diagnosis. In this video, I have listed 14 reasons why your periods go missing. And a correct diagnosis is what allows us natural healthcare practitioners to provide you with the correct advice and treatment so you can achieve optimal hormone health. You are supposed to have a period. Your period and your menstrual cycle are a sign of hormonal health, but these also represent your overall health. Losing your period is like the canary in the coal mine. It is the first health sign to go out of whack. It is a warning sign from your body telling us that your health in some way is struggling. It is your body asking us to pay attention and understand what is happening. And this health sign should be taken seriously. And your first step to taking this seriously is learning about the possible causes of your missed period, which you will understand by the end of this video. But first, it is important to try to understand what is happening hormonally in your body when your period is late or goes missing. Textbooks tell you you should get your period every 28 days. But what is the normal range for your menstrual cycle length? I will touch on menstrual cycle hormones and length in just a second, but I go into more detail about menstrual cycle length in my previous video, What is a Normal Period? So if you haven't seen that, feel free to check that out. Your menstrual cycle is controlled by a series of hormonal events that happen from one period to the next. These events include 1, your period, 2, the follicular phase, which leads to 3, ovulation, and following ovulation is 4, the luteal phase. When a pregnancy doesn't happen, the uterine lining will shed and the cycle begins back at your period. Now, a normal healthy menstrual cycle length is considered 21 to 35 days. Yes, the textbook menstrual cycle length says a cycle length is 28 days, but it is normal to have a cycle length anywhere from 21 to 35 days. If your menstrual cycle length is 35 days, you might consider this a late period, but this could be normal for you. The events of the menstrual cycle are broken down like this. The follicular phase goes from day 1 of your period, which is first day of full flow, until ovulation, and this can last anywhere from 7 to 21 days, and this is just the follicular phase. Ovulation takes place on one day and just in a matter of moments, and the luteal phase can last anywhere from 10 to 16 days depending on your sources. It is not possible for the luteal phase to be any longer than 16 days because the length of the luteal phase depends on the lifespan of the corpus luteum. And the corpus luteum lifespan will only ever last longer than 16 days in the event of a pregnancy. Please check out my previous videos, Anatomy and Hormones and Menstrual Cycle Explained, where I go into more details about anatomy, hormones, and phases of your menstrual cycle. My point here is, or the question that I'm answering is, what is happening hormonally in your body when your period is late or goes missing? You either 1, have a long follicular phase, which means that ovulation is delayed and happens later, or 2, ovulation doesn't happen at all, which means you can't move into your luteal phase. And the medical term for when ovulation doesn't happen is called anovulation. Even though your period is the most noticed event of your menstrual cycle, the goal of every single menstrual cycle is ovulation. This is where the egg is released out of the ovary every month. And in order to get a period, you need to ovulate. So if your follicular phase is longer, which means the ovulation is delayed, you will still move into the luteal phase, which still goes for 10 to 16 days. And this is where your period will come later than expected. And just to confuse you a little bit, you can still experience a bleed if you don't ovulate. I know, confusing, right? But we don't technically call this bleed a period. This is due to the estrogen production in the follicular phase. The estrogen in the follicular phase is stimulating the lining of the uterus to thicken and grow, and eventually this will need to fall away and shed. And in this circumstance, you can bleed without ovulating and without having a luteal phase. Now that you have a brief understanding of what is happening hormonally in your body if your period is late or missing, I'll now discuss the 14 reasons why your period could be late or missing. So number 1, the first reason why your period might be missing, and not always the most obvious, is pregnancy. It is really important for us to first rule out pregnancy. And there are always 2 groups of people that can react in very different ways in regards to whether your missed period could be a pregnancy. I have one group who are like, oh man, I can't be pregnant. I am not ready for a baby at this stage in my life. And the second group is saying, trust me, I am not pregnant. I have been trying for months, some even years, and it's hard for me to not do a pregnancy test every time my periods are late. So I really am trying to be sensitive to both groups of women here. But if sexual intercourse did take place, then we really need to rule out pregnancy as a possibility. In my space, natural health care, there are herbs that we cannot use in pregnancy as it has not been proven safe for the baby. So it is better that we rule this out sooner than later, so we can get you the right care and take the right actions for you. You may have already taken a pregnancy test and it's come back negative. It is possible that it is too early to detect the HCG levels, which means you need to take another test in a few more days. Before moving on to discover whether any other causes could be related to your late or missed periods, we first need to rule out pregnancy. And next, I'm going to mention breastfeeding, which is under the title of pregnancy. Breastfeeding women typically have higher levels of the hormone prolactin, which stimulates the production of breast milk. It is the high prolactin level that suppress or delay ovulation in some women. Now, let's get into the other reasons why your period could be missing, or you are experiencing delayed ovulation or even anovulation. And the second reason you could be missing your period is simply the stage of life you are in, and this particular stage that I'm going to talk about is being a teenager. As I discussed in my previous video, what is a normal period? A normal and healthy menstrual cycle length for adults is 21 to 35 days. But the second thing we can't overlook is the stage of life you are in. If you are a teenager, or you are still within 2 to 4 years of first getting your period, you could naturally have longer cycles. This is because the follicular phase in teenagers can be as long as 32 days. So that doesn't include then again the luteal phase. And the follicular phase can be longer because in teenagers it can take longer for the body to ovulate while the hormone system is still maturing. Therefore, a healthy menstrual cycle length in teenagers can be anywhere from 21 to 45 days. So if you are within 4 years of getting your first period, your period could be late simply because your hormone system hasn't completely matured yet. And if you don't have your period by the age of 16, it's really important to visit your doctor so you can get to the bottom of your missing period. And the third reason you might have missed your period is still the stage of life, but it's at the opposite end, and it is perimenopause or menopause. So perimenopause is the transitioning time where you move from your reproductive years to your more wiser years of menopause. And menopause is where your periods and ovulation completely stop. This is mostly a natural occurrence, but it can happen surgically in the events of having your uterus and ovaries removed. So back to perimenopause, the transitioning years. Perimenopausal years can last anywhere from 2 to 12 years. You heard me right? They can last up to 12 years. This is usually identified by the undesirable symptoms that we know from menopause, which is certainly not limited to, but includes hot flushes, difficulty sleeping, night sweats, midnight waking, heavier and longer bleeds, unexplained weight gain, shorter cycles, so they can come down and be under 21 days, or longer cycles and missed periods, which brings us to the point of this video. A great question to ask your mother, if you can of course, is what age did she go through menopause? Or more specifically, what age was she when her period stopped and never came back. Research shows us that daughters will go through menopause 5 years either side of their mother, which leaves a 10-year range. In a 2004 study, they found that almost half of the women experienced menopause around the same time as their mother. On average, the daughters experienced menopause 1 year earlier than their mother. And later studies showed similar results, where almost 40% of women who went through early menopause reported a family history of early menopause in either a mother, sister, aunt, or grandmother. So the average age of menopause is 51. And if you can experience perimenopausal symptoms for 12 years prior to this, that means that you could be 37 when you start experiencing symptoms of perimenopause. So ask the amazing women in your life regarding their age at menopause. And if still in doubt, you could see your doctor for a blood test to see if you are moving closer to menopause and this is the likely cause of your missed period. And this is only applicable if you've had regular menstrual cycles most of your life and now that you're moving into the older years, your cycles are changing. And the fourth possible reason you could miss your period is because of stress. Stress can impact period health in a huge way, yet we always underestimate its effects. We all have a HPO axis. So H stands for the hypothalamus, which is in the brain. The P stands for pituitary gland, which is also in the brain. And these two, the hypothalamus and the pituitary gland, are the master controllers for your hormone system. And the O in HPO stands for the ovaries. And this HPO axis is the hormonal communication between the brain and the ovaries that make the menstrual cycle possible. Stress directly affects the hypothalamus in the brain by decreasing the hormonal signal that comes from the hypothalamus, which is the hormone GnRH. Now, if the hormone GnRH is decreased, it sends a lesser signal to the pituitary gland, which means that the hormones from the pituitary gland are then decreased as well. Our pituitary hormones are FSH, follicle stimulating hormone, and LH, luteinizing hormone, and both of these hormones encourage ovulation. So if these are reduced, we will see a delay in ovulation. We can also look at the hormonal pathways to see how our fertility could be affected by stress. In this very simplified version of the hormone pathway, you can see that the main building block for all steroid hormone production is cholesterol. Then pregnenolone is needed to manufacture cortisol, estrogen, and progesterone. Your body prioritizes fight, flight, and survival over reproduction. So your body will prioritize the manufacture of cortisol over your reproductive hormones, as they are not needed for survival through this stressful event, and these are not the ideal circumstances for pregnancy and taking care of new life. So, irregular periods and missed periods can absolutely be a sign of acute or chronic stress. And how do you know if you're suffering from chronic stress? Well, other symptoms, if you are chronically stressed, could be symptoms of PMS. You could be feeling fatigued, anxious, or depressed. You could have sleep issues or lowered immunity, which means that you get sick often. And chronic stress can also be seen in people who have low blood pressure and low blood sugar issues. Improving relaxation and adding activities that bring you joy are definitely helpful strategies. But removing and reducing the stressor can be the most important thing you spend your time and energy on. Your reproductive hormones depend on you reducing your stress hormone cortisol. Now, there are many things in our life that can cause us stress, and for everybody, how you experience stress due to these circumstances can be very different. But if you are moving house, changing jobs, losing a job, having struggles with finances, having troubles in relationships, if you're having exams at school, or losing a loved one, and this list could go on and on. Now, moving on to the next 4 reasons your periods could go missing are really all causing a big stress to your body, but I've listed them as a singular cause as they deserve more attention. And the 5th reason that could cause you to miss your period is illness. Being sick is an acute stressor on the body. Your hypothalamus senses the stress, and your body prioritizes its energy into healing and dealing with the infectious agent. The stress again changes the hormone signaling temporarily, delaying or preventing ovulation until the body is well enough to function properly again. So we only see illness affecting ovulation, either delaying it or preventing it, if the sickness occurs prior to ovulation. So if the sickness happens in your follicular phase. If you have ovulated already, it is really rare for a sickness or an illness to affect ovulation. And the sixth reason you could miss your period is due to disruptions of your circadian rhythm. So you could disrupt your circadian rhythm if there are any disruptions to sleep. Either you are not getting enough, or you are waking regularly through the night, or simply due to shift work. The body sees this as a stressor and negatively impacts your circadian rhythm, causing dysregulation of your hormones. A 2011 and a 2016 study done specifically on women shift workers showed that the longer they were doing shift work, the greater incidence of irregular cycles. So in women who work shift work for longer than 20 months, we saw a greater incidence of irregularities, either with shorter cycles, so less than 21 days, or longer cycles of more than 40 days. So if you are a shift worker or your sleep is significantly disrupted and your menstrual cycle length is greater than 40 days, this can be a possible cause, but other causes, of course, should be ruled out as well. So even traveling when a change in time zone occurs, women can see short-term changes in their menstrual cycle and miss a period altogether. And the seventh reason you could be missing your periods is due to calorie restriction. Hypothalamic amenorrhea is a condition that causes your period to stop altogether. As I discussed earlier regarding stress and its effects on the menstrual cycle, calorie restriction is seen as a major stressor. The hypothalamus perceives this as a state of energy scarcity. So it prioritizes the limited energy or limited calories towards vital functions, and the hormones needed for reproductive function are downregulated to conserve energy. It is generally accepted that a certain body fat percentage is required for women to maintain the regularity of their menstrual cycle. This absolutely varies depending on individual factors, but most oftentimes, if the body fat percentage falls below 15%, it is highly likely that you will be missing your period. Hypothalamic amenorrhea can be caused by restrictive eating, undereating, extreme dieting, and eating disorders where the extreme calorie reduction reduces the production of our reproductive hormones, causing you to either not ovulate or ovulate late, and therefore you have a missing period. And the eighth possible reason why you might be missing your period or experiencing a late period is due to excessive exercise. In the cases where extreme exercise disrupts your menstrual cycle, this is mostly seen in women athletes or women who are exercising rigorously. When combined with calorie restriction and low body fat percentage, anovulation is more likely, and this is where you miss your period, and sometimes for many months. As stated above, if energy and calories are restricted, your body will shut down the reproductive hormones as these are not necessary for your survival. Excessive and prolonged exercise are seen as a major stressor to the body, and in these circumstances, we see an increase in cortisol, which interferes with the normal functioning of the hypothalamus and has a negative impact on the pituitary hormones FSH and LH, which are needed for the growth and maturation of the follicles, which then leads to ovulation. And if ovulation doesn't happen, you won't get a period. If you have lost your period to excessive exercise or hypothalamic amenorrhea, please know it can take many months for you to restore your menstrual cycle and your period health. Even after gaining weight and stopping exercise, it can take some time for your hypothalamus and your body to feel safe again in order to produce your reproductive hormones again to re-establish your menstrual cycle. And the ninth reason you might be missing your period is due to nutritional deficiencies. All nutrients are necessary for period hormones and health. There are some micronutrients that are difficult to get in your diet depending on your food intake. And a severe deficiency in these nutrients can cause reproductive hormone imbalances and ovarian dysfunction, where you may notice a missed period. The specific nutrient deficiencies that can be directly related to ovulation dysfunction and missed periods are zinc, vitamin D, and iodine. Please remember, as I said before, that all nutrients are really important for our period hormones and our general health. It's just these ones are particularly difficult to get in the diet. Zinc nourishes ovarian follicles and promotes healthy ovulation and progesterone production. So, a deficiency in this micronutrient could possibly cause a delay in ovulation. Vitamin D regulates hormone production of estrogen and progesterone, which is then essential for ovulation and a regular menstrual cycle. And iodine has direct effects on estrogen and ovulation. Iodine helps with the healthy processing and removal of estrogen, as well as maintains the estrogen receptors. And of course, all of this assists with a healthy ovulation. Therefore, nutrient deficiencies need to be assessed and then addressed when you are missing your period. And the 10th reason you might be missing your period could be due to medications. Everyone responds differently to medications, and not everyone who takes the medications that I mention in a moment will respond or react with irregular and missed periods. However, there are some types of medications that have been shown to impact hormone levels and potentially disrupt regular menstrual cycles. Now, some of these include antidepressants, blood pressure lowering medications, antipsychotics, anti-epileptics, the NSAIDs, which are the non-steroidal anti-inflammatories, and chemotherapy. So all of these have been shown at times to impact menstrual cycles and hormones. If you have just noticed changes to your menstrual cycle and you are taking any medications, it is best to see your doctor to investigate whether these medications could be causing disruption to your reproductive hormones and your menstrual cycle. Now, I can't talk about medications without mentioning the hormonal contraceptives such as the pill, patches, injections, or IUDs. These can absolutely disrupt menstrual cycle patterns, including lighter or absent periods. All these hormonal contraceptives will shut down your own internal production of estrogen and progesterone, and then give you synthetic hormones that mimic your menstrual cycle. What you think is a period is actually a withdrawal bleed, as the sugar pills have no hormones and you are bleeding in response to the withdrawal of the synthetic hormones. It can be normal for women who are taking hormonal contraceptives to have regular periods that mimic a 28-day menstrual cycle, or they can have irregular periods or no periods at all. But what happens to a lot of women when they stop hormonal contraceptives is something known as post-pill syndrome. This is when you stop taking the hormonal contraceptives and your period doesn't come back. This can last for a few months, and I've seen it last for years in some circumstances. As discussed before, your internal hormone communication system has been shut down due to the synthetic hormones, and in some women, it can take months or even years to get this system and hormonal communication up and running again. Not only will you have no periods, but it is also unlikely you will see a lot of cervical fluid, and you may not be producing the egg white cervical fluid that I discussed in lots of detail in the 4 types of cervical fluid. So check that out if you haven't seen it. When this is the case, I often see low hormone levels of FSH, which is our pituitary hormone, and low levels of ovarian estrogen. Low FSH can result from a history of taking oral contraceptives, fertility drugs, and some labor drugs such as Syntocin. If you have stopped taking hormonal contraceptives and you haven't got your period back, it is really important to be clear whether you have post-pill syndrome or PCOS, and be clear about the diagnosis, as treatment options used for PCOS can cause a swing from post-pill syndrome to hypothalamic amenorrhea, further worsening reproductive hormone production and irregular cycles. So please make sure that you have a correct diagnosis before moving forward with treatment. And the 11th possible reason you might be missing your period could be due to polycystic ovarian syndrome, which is also known as PCOS. Irregular or missed periods is the most common symptom of PCOS. In women with PCOS, the ovaries can't function properly due to hormonal imbalances. One of these hormonal imbalances is high testosterone. And if you have high testosterone, it is quite unlikely that you will experience regular menstrual cycles and ovulate around the same day in your cycle each month. High testosterone interferes with the proper development and release of eggs from the ovaries, causing you to ovulate at different times each menstrual cycle, or maybe not ovulate at all, giving you irregular or missed periods. If you have PCOS, you might suffer from some other symptoms such as unwanted facial or body hair, unexpected weight gain or difficulty losing weight, and you could also have high insulin levels and issues with blood sugar. If you think you have PCOS or you have been given a PCOS diagnosis, it is so vital that you make sure that this diagnosis is correct. You are welcome to check out my free PCOS diagnosis download so you can check and understand the PCOS diagnosis criteria. And the 12th reason you might be missing your period could be due to thyroid disorders or thyroid imbalances. Thyroid hormone imbalances and thyroid disorders can absolutely disrupt reproductive hormones and cause missed periods. Thyroid-related issues impact your pituitary gland that is responsible for hormones that help your ovaries ovulate. Essentially, there are two types of thyroid diseases. We have hypothyroidism, which is underactive thyroid, or we have hyperthyroidism, which is overactive thyroid. So first, I'll explain hypothyroidism. This is where your thyroid gland doesn't produce enough thyroid hormone. Low thyroid hormone levels can cause a few different menstrual irregularities, such as 1, anovulation, and this is where ovulation doesn't happen and we have delayed or missed periods. And number 2, in severe cases, women can suffer with amenorrhea because of low thyroid hormone production. And this is where there is complete absence of a period for many months at a time. And 3, some women can see prolonged menstrual bleeding where their bleed is heavier and goes for more days than normal. So if you are experiencing missed periods and it could be due to hypothyroidism, some other symptoms that you might be experiencing is intolerance to cold, tired and fatigue, unexplained weight gain or not being able to lose weight despite your diet, and constipation. So if you are missing your period and experiencing some of these symptoms, it is really important you see your doctor and have your thyroid checked out. In hypothyroidism, blood test levels of TSH often come back high, which indicates low thyroid hormone function. A high TSH can also elevate prolactin levels, and as we saw in the breastfeeding example, prolactin can inhibit ovulation because it can affect the production of estrogen and progesterone. And the second thyroid hormone disorder is hyperthyroidism, and this is where your thyroid gland produces excessive amounts of thyroid hormone. And this thyroid condition can also affect menstrual cycles, and you can see irregular cycles. But rather than having long cycles as we usually see in hypothyroidism, we see shorter menstrual cycles where you are actually getting your period more frequently. And 2, in hyperthyroidism, we usually see a decreased menstrual flow. So periods can be lighter and become more infrequent. And 3, hypothyroidism can cause amenorrhea again in severe circumstances. Now, for someone who is suffering from hyperthyroidism, some other symptoms that would come along with this condition would be a high metabolism. So feeling hungrier, but not able to put on weight. You can also feel warmer than others in certain climates, and you can definitely sweat more than you're used to. You can also feel agitated, anxious, and some can even experience heart palpitations. Blood tests often show a low TSH, which indicates that thyroid hormone production is high and overactive. So in circumstances where there is a low TSH and we have hypothyroidism, we can also see high testosterone levels, which, as we know from the condition of PCOS, will disrupt ovulation and cause a delayed or a missed period. So if you are missing your periods, get to your doctor and please have your thyroid hormone assessed. And the 13th reason why you might be missing your period could be due to high prolactin. So we've mentioned prolactin a couple of times now throughout this video. Prolactin is our milk producing hormone and is particularly important for women who are breastfeeding. When your prolactin is high, it can suppress the production of your reproductive hormones, estrogen and progesterone, which then inhibits ovulation, causing a delayed or a missed period. So there are a few reasons why you could experience high prolactin, and we've already discussed breastfeeding. So number two, or the second reason you could have high prolactin could be due to a benign tumor on your pituitary gland that is secreting this high prolactin. That condition must be treated with pharmaceutical medication, so you do need to see your doctor in circumstances of having a missed period so these can be diagnosed correctly. The third reason why your prolactin could be high, as we've discussed before, is hypothyroidism. So low thyroid hormone levels can cause high prolactin levels. And the fourth reason why your prolactin can be high could be due to stress, as prolactin can often mimic cortisol. So in times of stress, when cortisol is high, we can also then see a high prolactin. And the 14th reason why you might be missing your period is due to premature ovarian failure, which in simple terms is early menopause. This is where the ovaries stop functioning properly before the age of 40. Premature ovarian failure results in a reduction in the number and quality of eggs in the ovaries. The ovaries don't produce and release eggs regularly, therefore the ovaries produce lower levels of the hormones estrogen and progesterone. These hormonal imbalances either delay ovulation or ovulation doesn't occur at all, causing irregular cycles or missed periods. The reduced ovarian function causes an elevation of the pituitary hormone FSH, or follicle stimulating hormone, in the blood. FSH is normally responsible for the development and maturation of the follicles that hold the eggs in the ovaries. But now, as the ovaries are no longer responding very well to this FSH, we see fewer mature follicles and anovulation. And if ovulation doesn't occur, periods go missing. As you can see from this extensive video, there are 13 other reasons why periods could go missing. And it is worth investigating these causes with your doctor so you can have a proper diagnosis and then, of course, the correct treatment. You have control over your body, even though it doesn't feel like it sometimes. You can take back control by 1. Learn as much as you can about your body and try to understand the possible causes of what's happening to you. And 2, track your cycle, meaning track the length of your menstrual cycle, track your fertile window, and track ovulation. These 2 useful tools can be used both to help you prevent a pregnancy if you don't want a baby right now, and they can also help you if you are trying to conceive. And I'll cover these 2 topics in my next 2 videos, so please hit the subscribe and notification bell so you will know when these videos are released. See you then.